15 years ago, Paul's mother was at the point of despair. What was she going to do with her child with disability? She could not see any future for her child. Would she be able to cope? Would Paul be able to have any quality of life? She felt like giving up. She even thought about abandoning Paul or placing him in an institution. But that was not the end of the story. Somebody told her about an agency that provided services for children with disabilities and their families. In desperation, she went to them, and that is where the story changed. She was able to access education, therapeutic services, training, family support for herself and Paul. And today, Paul is a confident young man who is gainfully employed, who continues to speak out and advocate for the rights of children with disabilities to ensure that they also can access the necessary support services to enhance their development. But sadly, that is not the story for many of our children with disabilities. But in this case, one child's life was changed. And what made the difference? Advocacy, access to support services, and the community and stakeholders working together to ensure that children with disabilities and their families have access to services and support that they need to enhance their development. Marty?
Hello, I am Omati Madre from ChildLinK, and with me is my colleague Sandria. Sandria will tell you a little bit about herself. We work collaboratively on a project we call the One Life 2 initiative, in which we focus on strengthening educational access and parenting skills education for children with a disability. Sandria?
Yes, and I'm Sandria Longwhite from Community-Based Rehabilitation in Jamaica. We provide services for children with disabilities at community level and through educational programs that serve to enhance their development and also for their families to ensure that they indeed can provide the support for their children with disabilities.
In this period, which we called Family Week, we are very happy to share with you during the observance of the 30th anniversary of the UNCRC. We would tell you a little bit of our work that we are doing as a joint action with the aim of regional collaboration and regional advocacy in the Caribbean. According to the World Bank estimates, there are over 200 million children that are excluded from the school system, and mainly because of disability, gender identity, and in some instances, poverty. And even where children are in schools, it's estimated that over 60% of those children are not completing schools with basic literacy skills. Many children with disabilities are not given the support and the chance to develop skills for their livelihood, for achieving to their full potentials, for social protection. In the Caribbean, some countries have progressed and have integrated a good focus on disability across the education sector. And this is the case for Jamaica. However, a similar approach has not happened in Guyana. It's therefore in this regard that we built a collaboration with CBRJ for some practical outcomes for children with disability. And these includes building the skills of teachers and education officers, building the skills of parents, and integrating children with mild autism into the education sector. We also focuses on lobbying our Ministry of Education to adopt the special education needs policy that will ensure that children with disability can access education.
It's important for us as Family for Every Child to support parents, communities, and children to influence governments to provide adequate support and services for children with disabilities. And this concept is embedded in the UNCRC, which is a framework that guides the development in countries to include all children and to reach the most vulnerable with adequate services. And this is what guides us when we develop our programs. Because while all children have equal rights to live in a family environment, many children with disabilities continue to spend much of or all their lives in group homes or other residential institutions, or they're abused if they're living with their families, or neglected and deprived of their basic rights. We find that when this has changed, children with disabilities who receive good care and developmental opportunities, especially when they're young, in the early childhood stage of their life, they're more likely to become healthy and productive adults. And this has great implication for the government, because this can potentially reduce the future cost of education, medical care, and other social spending. Now, since 2017, ChildLinK and CBRJ have been working together to look at the issue facing our children with disabilities in our own countries and within the region. And we have embarked on joint advocacy initiatives with the aim of, one, establishing a Caribbean regional network to influence national and regional policies and systems, targeting changes to the alternative care framework and protection system for our children with disabilities. And this is our aim for 2022. Now, next slide, we have approached it from a national level and a regional level. At a national level for CBRJ in Jamaica, we are seeking to strengthen our parenting network towards having a unified voice advocating for the rights of their children with disabilities and for adequate services and support through policy implementation and programs. And this is with the technical support and collaboration with ChildLinK. Now, we're also working with the Ministry of Education, Youth and Information to strengthen our collaboration to provide greater access to education through access to appropriate education support services in the regular schools themselves and through special education facilities. And we have, with the help of the Ministry of Education, identified schools that have children with mild autism within the school that need the support of training for the teachers. We are also doing parent training, because the parents need the skills to ensure that they can support their children through the education system and also at home. And we are also working to create greater collaboration within the NGO sectors within Jamaica itself. So we are in dialogue with other stakeholders, other agencies within the sector. And we have been having discussion with them and will be having face-to-face meeting with these agencies within the coming year.
The collaboration with CBRJ has many interesting points for us. CBRJ has the know-how and the technical expertise on working with children with disability. ChildLinK has the experience of working in collaboration with grassroots, with national agencies, particularly our government agency. And so this is where we are able to strengthen our local work and scale it up to regional advocacy. At the national level, both ChildLinK and CBRJ are building the capacity and skills of education officers and also working with families and supporting children within the school setting, so that children who are going to school with a mild disability are not left at the back of the classroom, or not ignored, or not further stigmatized and abused. But we work with the parents and the teachers through what Sandra referred to early on, and probably will speak a bit more on it, is the individual education plan. This has actually been a new learning for us, and we've actually just completed a training with a consultant from Jamaica on how teachers can develop the plan with parents and children and the social worker to create positive outcomes for children. At the regional level, what we have been doing together is agreeing to work together, building up a joint action, a joint activity of training teachers and training parents, and helping the regional education officers to understand that there needs to be a greater focus on children with disability, and helping that process to be more friendly for for families to access the care that their children need, or to lobby for the care their children need. We've also consulted with other local stakeholders, both in Jamaica and Guyana, and we have scheduling our first online meeting for 2020. So at this stage, whilst our local and national work is progressing, we are also identifying regional stakeholders that we will begin to bring in as new stakeholders into this process to scale up the work for children with disability in the Caribbean region.
We mentioned earlier about the UN Convention on the Rights of the Child, and our advocacy initiatives are linked with the UN Convention, and in particular, Articles 23, 28, and 29. Focusing on Article 23 now, which speaks about children with disabilities, and that a child with disability has the right to live a full and decent life with dignity and, as far as possible, independence, and to play an active part in the community. We are ensuring that we work with our teachers and with our families in particular, to build the capacity of our parents to support their children. And if we look at the next slide, we see that for Article 23, we are trying to improve the knowledge and skills of education officers, local partners, and caregivers in Guyana and Jamaica, and building the parents' capacity to support their children. Now, how we're doing that, if we move on to the next slide, we are implementing strategies with the families through training to give them the skills to be able to take care of their children. And the positive impact that has is that there's acceptance, empowerment of the parents themselves, they are motivated, and their lives are enriched. And the children with disabilities are accepted as valuable members of the family and recognized that when they're in the home, that is the best place for them. And the home provides the caring and nurturing environment that is needed. We're going to move on to Article 28, and Marty's going to be speaking to that one.
Article 28 tells us about the right of every child to access education. And in many instances, we tend to quote this right as if it's an automatic process. But in many countries, particularly developing countries, children with disability are more likely to be hidden, hardly likely to be going to school. And for those that are going to school, teachers don't always have the know-how on how to work with children with disability. And so one of the big ways in which we are addressing this right is building the teacher's capacity and having a social worker work with that teacher, also bringing the parents more on board, because many parents are sending their children to school not understanding their children's disability, not knowing how to help their child, and not recognizing what kind of progress their child can make. And this is what the individual education plan will do. Teachers have been trained on how to develop a plan for each child with a disability, and to set some realistic target that that child can achieve in terms of reading, in terms of writing, in terms of social skills. And so this is one way in which we are helping children to access their right to an education.
Right, and that flows right into Article 29, which speaks to goals of education, and that education must develop every child's personality, talents, and abilities to the fullest. Right? So we're at
we also, in reference to Article 28, and influencing the education sector, our partnership in both Jamaica and Guyana has been built with the Ministry of Education. Yes. And our aim is not to identify teachers and train them, but really to work with the ministry so that they identify the teachers, and that they are part of that process that brings the teachers and the parents and the children together. In addition to that, we work with our local partners. This slide will show you in Guyana, there's a national autism walk every April. The walk is usually, the feature address is brought by our First Lady, as you would see as well in the slide. And really it's to bring the education department on board, bring other local stakeholders on board, and really creating more of an awareness so that children and their families feel more confident to access the services, feel less stigma and discrimination, and really to strengthen the awareness around the issue of disability and how, as a society, we can be more supportive to children and their families.
Okay. I think Article 29 also, Amati, spoke to some of those issues as it relates to the influence in the education sector to educate children with disabilities. And she mentioned about the individual education plan, which is something that we are using to, well, train our teachers to ensure that every child, that the program that they have is individualized, because every child's need is different. So the program that they use, the education program, must address those specific needs and be implemented in such a way that it will help the child to learn, to ensure that they are indeed learning and being able to benefit from the program that they're in. And it takes collaboration with, well, the Ministry of Education, which we have been working on through the project to ensure that this is there, and that we're working together to ensure that not only that the teachers have the knowledge, but that they have the resources at the classroom level to be able to implement the appropriate programs for these children. And as we move on to the next slide, we are going to be looking at, well, this is the call to action for everybody to be involved in this process. And not only, well, if you look at our slide, we want our parents and caregivers to be involved in the advocacy process. Our parents need to know their rights and the rights of their children. They need to advocate for the services that are needed to support their children. And also not just that the services are there, but that they are accessible. We're calling on self-advocates, persons with disabilities, to speak out about their needs, what they did not get, and what is needed to ensure that our children have access to full development. We are calling on the private sector organizations. Create opportunities for persons with disabilities to find work in your organizations. Ensure that disability is part of your organization mandate to make your services accessible to persons with disabilities. And to ensure that, well, create volunteerism within your organization. Give back. There are a lot of community groups who need the help. There are a lot of initiatives that are there that you can give back to, support these, and also work closely with the government to ensure that where there's a gap, that you can fill this gap also.
We're also calling to action civil society organizations, government, and human rights organizations. Civil society organizations generally target a particular vulnerable group based on their niche. And we are asking civil society organization to ensure that disability is mainstream in their program, and that it's children and families are included. We're also asking our government to ensure that we have policies that are updated, that services are available, that we are working collaboratively with civil society, with private sector, with communities to ensure that all stakeholders are understanding the issues of disability and are really able to function and to take forward their roles so that children and families in school, in the workplace, in the communities are really at the receiving end of good policies and good services. International organization, human rights organization, the UN, We believe that the UN can hold government more accountable for their commitment. We believe that these international organizations can link government to technical and financial resources to ensure that policies are rolled out and delivered in countries where these policies don't exist, or where these policies are not adequately implemented. And we believe that there needs to be more research on the issue of disability. There's so much more to learn on the issue of autism, which is one of the focus area of our work, mild autism. How do we help children to be in a classroom, to be with other children, to be in an environment where they're being taught, and even to communicate with their own within their own families. And last but not least, we recognize that in any country across the globe, there's about 10 to 15% children, people living with a disability, and so it's a global issue, and therefore needs to have more of an emphasis across programs, across policies, so that children and people with a disability can not only access the services, but can also make their contribution. Sandra, any final word from you?
Just a call for everybody to be, well, watchdogs for areas that there are policies in place already, acts in place already. Ensure that you hold the government to these actions and these policies. For parents, equip yourself with knowledge. What is available, what you need to know, what you can do to ensure that the services are there, and take action. Join together, take action. Make sure it is everybody's business.
And thank you very much from all of us at CBRJ and ChildLinK. Thank you for listening.
Thank you too. Bye.